My name's John Wilding. I'm a Professor of Medicine at the University of Liverpool, and I work at a hospital called Aintree Hospital in Liverpool. And I specialise in treatment of type 2 diabetes and treatment of patients with weight problems, many of whom of course have a high risk of going on to develop diabetes. And my research is also in those two main areas. So I also do treat people with type 1 diabetes, and type 1 diabetes can occur at any age. Sometimes it starts in childhood. We find the highest rates of diabetes are in the teenage years, and then it starts to drop off. But we do see adults with developing type 1 diabetes right up into their 60s and 70s even. Well, I think it's type 1 diabetes is partly a genetic predisposition. So we know that if you have certain genes that relate to your immune system, then people who have those differences in their genes are more likely to develop type 1 diabetes. But we know it's not 100% genetic, because even if you have the same genes, like you have an identical twin, only about a third of those twins with the second twin would also get diabetes. So we know there must be some environmental insult that is causing diabetes. Now, the possibilities are, the most popular one is that this is some virus infection that we maybe acquire during childhood, and that's maybe one reason why it's more common in teenage years, because at that age is when most of us are being exposed to lots and lots of infections and viruses and so on. Okay. But it's also possible, and there is some evidence, that it may be something else in the environment. It may be something that we in the diet, it may even be something that we breathe in the air, but we just don't really know. I mean, those are still mysteries that we're trying to unravel. Well, so I've been working in diabetes research even since I was a medical student. So I found diabetes a very interesting condition. It's a very common condition. It affects a lot of people, and it's a chronic disease. And so we know that if you manage it well, people can lead long and healthy lives with diabetes. But if it's not managed well, then you can develop complications, and those complications can be quite severe. They can include visual problems and blindness, they can include kidney failure, increased risk of heart disease, increased risk of amputations. And so all of our goals in diabetes research are firstly if we could prevent diabetes, that would be fantastic. But even if we can't prevent it, then if we can do good work to help prevent people getting complications so they can live long and healthy lives with diabetes, that is perhaps the goal that many of us would see as being a good intermediate step until we can find a cure.
And what's the clue?
Yeah, well, it depends whether you're talking about type 1 or type 2 diabetes. For type 1 diabetes, we may be talking about some way of perhaps, in theory, you could vaccinate if we knew which the virus was, or we could remove the environmental damage if we knew that was the case, or we could provide some immune treatments that help protect those people who are most at risk. For type 2 diabetes, we actually have very good, effective ways of preventing it already, because type 2 diabetes, which occurs more commonly in older people, is very strongly related to obesity and physical inactivity. And we know that if you take people who have not yet got diabetes, but we all know they're on the path to diabetes because their blood sugar is a little bit high, and we get them to exercise more, and we get them to lose weight and have a healthier diet, then we can more than halve their risk of going on to develop diabetes later on. So we already have an effective treatment there, but the difficulty is actually being able to deliver that in the population where there are so many pressures for us to eat unhealthy food, and it's very easy to spend a lot of our time sitting and not being active. And so we have to try and encourage people to lead a more active lifestyle and to make healthier food choices. Well, not necessarily sport. I mean, sport is one way of physical activity, but actually for most people, just being able to move around a little bit more would be protective. We think that just 30 minutes of moderate to brisk activity on 5 or 6 days of the week could have a very big impact. And we know that more than half the middle-aged people in the UK and probably also in Sweden don't even do that. So you don't need to be going to the gym every day. You just need to get up and go for a walk.
Okay, and the food also as well.
Yeah, and try and choose healthy foods, less sweet foods, less refined carbohydrate, less high-fat foods is probably the healthy way to go. More fruits and vegetables, more whole foods, always good.